Many people think it's just hunger, stress, or spicy food, but it could actually be a stomach ulcer. Left untreated, a hole in the stomach. In this video, you'll learn what stomach ulcers are, what causes them, the warning signs you should never ignore, how doctors diagnose and treat them, and whether home remedies really work. Make sure you stay until the end, because one common mistake prevents many people from recovering properly. That burning pain in your stomach might not be something you should ignore. Many people think it's just hunger, stress, or spicy food, but it could actually be a stomach ulcer. Left untreated, a stomach ulcer can lead to serious complications, including dangerous internal bleeding and, in rare cases, a hole in the stomach. In this video, you'll learn what stomach ulcers are, what causes them, the warning signs you should never ignore, how doctors diagnose and treat them, and whether home remedies really work. Make sure you stay until the end, because one common mistake prevents many people from recovering properly. If you enjoy simple, reliable, evidence-based health information that helps you protect yourself and your family, please like this video, subscribe to Medical Wisdom, and turn on notifications so you never miss our weekly health guides. Let's get started. A stomach ulcer, also known as a gastric ulcer, is an open sore that forms in the lining of the stomach. It is one type of peptic ulcer disease, which also includes ulcers that develop in the first part of the small intestine. Your stomach naturally produces powerful acid to help digest food. Fortunately, it also has a thick layer of protective mucus that shields its lining from that acid. When this protective barrier becomes damaged or weakened, stomach acid can begin attacking the stomach lining itself, eventually causing an ulcer. Although stomach ulcers are common, they should never be ignored because untreated ulcers can lead to bleeding, infection, and other serious complications. Interestingly, doctors once believed that stress, spicy foods, and excess stomach acid were the main causes of stomach ulcers. Patients were often told to avoid spicy meals, reduce stress, and take medications to lower stomach acid. While these treatments sometimes eased symptoms, ulcers often returned. Everything changed in 1982 when Australian doctors Robin Warren and Barry Marshall discovered that many stomach ulcers were actually caused by a bacterium called Helicobacter pylori, commonly known as H. pylori. Their discovery completely changed the way stomach ulcers are treated and has helped millions of people recover successfully. If you've learned something new already, type helpful in the comments below. So, what actually causes a stomach ulcer? The two most common causes are infection with Helicobacter pylori bacteria and long-term use of non-steroidal anti-inflammatory drugs, also known as NSAIDs. These include common pain relievers such as ibuprofen, aspirin, and naproxen. H. pylori bacteria can weaken the stomach's protective mucus layer, making it easier for stomach acid to damage the lining. Meanwhile, frequent use of NSAIDs reduces substances that normally protect the stomach, increasing the risk of ulcers. Less commonly, ulcers may develop because the stomach produces excessive amounts of acid. A rare condition called Zollinger-Ellison syndrome can also cause unusually high acid production, leading to ulcers. Certain factors can increase your risk even further. Smoking slows the healing of ulcers and makes new ulcers more likely to develop. Heavy alcohol consumption can irritate and damage the stomach lining. Regular use of steroid medications may increase risk, especially when combined with NSAIDs. A family history of ulcers may also increase your chances, and people over the age of 50 tend to be at higher risk, although ulcers can occur at any age. Do any of these risk factors apply to you? Let us know in the comments. One of the most surprising things about stomach ulcers is that some people experience no symptoms at all. However, when symptoms do appear, the most common is a burning or gnawing pain in the upper abdomen. This pain often becomes worse when the stomach is empty, between meals, or during the night. Other symptoms may include bloating, heartburn, nausea, vomiting, loss of appetite, frequent burping, and feeling full after eating only a small amount of food. Many people ignore these symptoms, assuming they are simply experiencing indigestion. Unfortunately, delaying treatment can allow the ulcer to become much more serious. There are certain warning signs that should never be ignored. Seek emergency medical care immediately if you vomit blood, notice black or tarry stools, develop sudden severe stomach pain, experience fainting or dizziness, or lose weight without trying. These symptoms may indicate internal bleeding, a perforated ulcer, or another life-threatening complication that requires urgent medical attention. The good news is that stomach ulcers are usually easy to diagnose. Your doctor will first ask about your symptoms, medical history, and any medications you take regularly. To confirm the diagnosis, they may recommend a breath test, stool test, or sometimes blood tests to detect H. pylori. In many cases, an upper endoscopy is performed. During this procedure, a thin, flexible tube with a tiny camera is passed into the stomach, allowing doctors to see the ulcer directly and, if necessary, take a small tissue sample for testing. Now let's talk about treatment. The good news is that most stomach ulcers heal completely with the right treatment. If H. pylori infection is the cause, doctors usually prescribe a combination of antibiotics to eliminate the bacteria along with proton pump inhibitors, often called PPIs, to reduce stomach acid and allow the ulcer to heal. If NSAID medications cause the ulcer, your doctor may advise stopping or changing those medications if it is safe to do so. Other treatments may include H2, receptor blockers, antacids for temporary symptom relief, and medications containing bismuth that help protect the stomach lining. Even if your symptoms disappear after a few days, it is extremely important to complete the entire course of medication exactly as prescribed. Stopping treatment too early may allow the infection to return and increase the risk of another ulcer. If you know someone who frequently complains of stomach pain or regularly uses painkillers, share this video with them. It could help them recognize the warning signs before serious complications develop. Now, let's answer one of the most common questions. Can home remedies cure stomach ulcers? The answer is no. While some foods may help soothe the stomach or support healing, they should never replace proper medical treatment, especially if H. pylori infection is present. Foods such as cabbage, bananas, coconut water, coconut milk, fenugreek, and deglycerinated licorice, also known as DGL, may provide some supportive benefits. However, current scientific evidence does not show that these remedies can cure stomach ulcers on their own. The safest approach is always to follow your healthcare provider's treatment plan while maintaining a healthy diet. Fortunately, there are several ways to reduce your risk of developing a stomach ulcer. Wash your hands regularly to reduce the spread of H. pylori bacteria. Avoid smoking because it damages the stomach lining and slows healing. Limit alcohol consumption to prevent irritation of the stomach. Only use NSAID pain relievers when necessary and always follow your doctor's instructions. Eat a balanced diet rich in fruits, vegetables, and whole grains, and try to manage stress through regular exercise, adequate sleep, and healthy relaxation techniques. Although stress alone does not directly cause stomach ulcers, managing it can improve your overall digestive health and well-being. Here's the most important message to remember. Stomach ulcers are common, but they're also highly treatable when diagnosed early. Most ulcers are caused by Helicobacter pylori infection or the long-term use of common pain-relieving medications such as ibuprofen, aspirin, and naproxen. If you continue experiencing stomach pain, especially burning pain that keeps returning, don't ignore it. Early diagnosis and proper treatment can prevent serious complications and help you recover much faster. If you found this video helpful, please give it a thumbs up, subscribe to Medical Wisdom, and turn on the notification bell so you never miss our evidence-based health videos. Also, leave a comment below by typing, "I learned something today." Your comment helps this video reach more people who may need this important information. Thank you so much for watching. Stay healthy, stay informed, and remember, your health is your greatest wealth. See you in the next video.